stem.
Okay, ma'am, I'm ready.
Both are ready?
Yes, ma'am, I'm ready.
All right. So if you've read and understood, considering it communication skills station, please begin.
Hello, I'm Dr. Ali Hayat, CT2 surgical resident working for Mr. Mann from London Hospital. I'm calling to talk to Mr. David, the vascular consultant, to ask advice about a patient. Can I confirm that I'm talking to Mr. David?
Yes. Summarize your case, doctor.
Okay, a 54-year-old lady admitted to our hospital with the diagnosis of mild diverticulitis, which was getting better with IV antibiotics and fluids. But now patient have a severe left lower limb pain, and the arterial duplex showed acute limb ischemia along with ECG showing atrial fibrillation and preventricular complex. And ABG, on the other hand, is showing hypokalemia and metabolic acidosis. And we were hoping if we can transfer the patient to your care for the definitive management.
Okay, doctor. Is it urgent? Can we send it tomorrow morning instead?
Yes, it is urgent as patient is having acute limb ischemia, and it is good to early do intervention so to save the limb.
Okay, doctor. Why do you suspect an acute limb ischemia, doctor?
As it is showing on the arterial duplex that it is acute limb ischemia, and patient is also having atrial fibrillation. So we are suspecting that patient is having acute limb ischemia.
Okay, doctor. Will we need to have a cardiologist review the patient before we transfer the patient?
Yes, but acute limb ischemia is more serious, and preventricular complex and cardiology opinion can be taken later.
What do you think is the cause of the arrhythmia?
Cause of what? Arrhythmia?
Yeah, you mentioned preventricular complex.
Yeah, probably there could be some electrolyte imbalance that may cause the preventricular complex to be found. Or
Okay.
patient can have ischemic heart disease, for which patient is having AFib as well.
Okay. What do you think of a presumed diagnosis? What do you think of the diverticulitis?
Well, now as patient is having atrial fibrillation on ECG and there is acute limb ischemia, so I think the patient might have mesenteric ischemia, the cause of the pain of the abdomen.
Okay. What is your differential diagnosis, doctor?
A patient has acute limb ischemia. Patient could have severe diverticulitis or sepsis, or any viscous perforation, uh, or mesenteric infarction.
Okay. Do you want to scan the abdomen, doctor? Would you like to scan the abdomen first?
No, I think we can scan the abdomen after the patient is transferred to your care, as patient is having acute limb ischemia, which is an emergency.
Could it be mesenteric ischemia? And why does your consultant save the ball first?
Yes, it could be mesenteric ischemia, but at the moment the abdomen is soft and non-tender, and I would be doing the serial abdominal examination. And we would also do CT abdomen with contrast if the renal function is normal after the patient is transferred to your care.
Okay, doctor, how will you want to transfer the patient? And what will you prepare for the transfer?
Yeah, I will arrange an ambulance that is equipped with cardioversion, monitoring, and cardiopulmonary resuscitation.
Okay. So, doctor, tell me, what is your management plan?
In this patient, we need to correct hypokalemia, metabolic acidosis, and need to give anticoagulants, and also need to correct the atrial fibrillation. And for that, I would arrange with the ICU staff to start cardioversion and anticoagulants and complete it on the way to the hospital.
Okay. What will be your definitive management for the patient?
If the limb is viable, I can do thrombolysis or embolectomy, or I can do the bypass surgery. But if the limb is unviable, then we'll have to go for amputation.
Okay. What else would you like to do in addition to what you just mentioned, and why?
I would also give the medical management. I would give unfractionated heparin of 5,000 international units as bolus and 15 international units per kg per hour infusion, and keeping the APTT between 30 to 40 seconds. And
Would you like to
it
do
is,
would you like to do a
yes,
vasectomy for this patient?
yeah, fasciotomy may be or maybe not needed.
What is reperfusion injury?
Sorry, can you please repeat?
Okay, what is reperfusion injury?
Okay, reperfusion injury is when there is acute obstruction or occlusion of the blood to the tissue or organ, and when the obstruction is relieved, the toxins or inflammatory cytokines can damage that tissue and cause more inflammation and edema.
Okay. How to manage atrial fibrillation?
Atrial fibrillation can be managed with cardioversion and anticoagulants, and I would, for this patient, arrange it with ICU staff to start cardioversion and also give anticoagulants and to complete the anticoagulation on the way to the hospital.
Okay. How will you correct the hypokalemia?
We can give supplemental. We can count the deficit and also count the maintenance of potassium and add it into the IV fluid that we give to the patient.
Now, doctor, tell me, what will you tell her family?
I will tell them that patient has developed acute reduction in the left lower limb, and for this patient needs early intervention, and for this patient is being shifted to is being transferred to a vascular consultant for the definitive management.
What is the early sign of ischemia?
Early sign of ischemia is pain, cold periphery, cold limb, or discoloration, or pale discoloration, pain, and cold limb.
5P.
Yeah, 5 p.m. Where does the pain
pallor,
come? Yeah. Where does the pain come from? Why the pain?
because of the nociceptive receptors present in the around the skin that is being supplied by that critical blood vessel that has been occluded, that causes it to have pain.
Okay. How will you know the limb is viable? What test will you do to know the limb is viable?
To check for the peripheral pulses and capillary refill.
Refill. Good.
2 point discrimination.
Good.
Thank you.
Okay.
Thank you. You can send the
What?
patient over. Are you done with your
Okay.
questions? Yes? Okay, thank you.